Hello everyone, my name is Charity Ehim and I'm here to present an overview of a psychotherapy section with my patient who is 60 years old or African American male with no significant past medical history who presented to the clinic with a complaint of sadness, anxiety, helplessness, mood changes and irritability. He says that all this started 6 months ago when he lost his wife. He thought he would overcome these feelings with time, but and did not seek intervention. But now it is getting worse by the day, and his children are getting concerned and worried, and they have urged him to see a therapist before it gets worse. This patient was seen last week in the clinic with a diagnosis of depression, major depression, using the DMV5 criteria. We will use psychotherapy for his treatment without incorporating medications for now. As an African American, he believes, according to him, that men should not suffer depression and does not think psychotherapy will help him because psychotherapy he believes is meant for people with mental insanity. So my understanding of psychotherapy is a variety of treatment that aim to help a person identify and change troubling emotions, thoughts, and behaviors. It is a collaborative treatment based on the relationship between an individual and the therapist. It is a treatment that can help individuals experiencing various mental health conditions and challenging emotions. Psychotherapy is essential because it helps to build self esteem, reduce anxiety, strengthen coping mechanism, and improve social and community functioning. Psychotherapy helps people to know themselves better, elevate emotional pain and confusion, and establish more effective coping methods. Cognitive behavioral therapy, CBT, is a psychosocial intervention that aims to reduce symptoms of various mental health conditions, primarily depression and anxiety disorder. It is one of the most effective means of mental health treatment. So, I will be using three types of psychotherapy for this patient. First, I will use the rational emotive behavior therapy, otherwise known as REBT. It is an action oriented therapy that helps people learn to manage their emotions better. REBT is a type of CBT that focuses on changing irrational thoughts or beliefs that negatively affect a person's emotion or behaviors. The goal of REBT is to enhance and maintain emotional and behavioral functionality. My second psychotherapy will be interpersonal psychotherapy, also known as IPT. Is a form of psychotherapy that focuses on relieving symptoms by improving interpersonal functioning. This aims to help people address current concerns and improve interpersonal relationships. Interpersonal therapy is a short-term therapy for depression. The third one will be a supportive um, psychotherapy, which is a type of therapy that focuses on providing emotional support, encouragement, and validation during difficult life circumstances or psychological challenges. This encourages people to discuss their feelings, concerns, and problems on a safe, non judgmental environment. Supportive psychotherapy mainly help to work through present and immediate concerns, including relationship issues and family or related stress. Supportive therapy is to help patients deal with their emotional distress and problems. It emphasizes on reassurance, re-education, advice, persuasion, and encouragement of desired desirable behavior. I decided to use these three psychotherapies because I believe my patient is going to benefit a lot from this therapy because of his diagnosis of depression. So these three therapies are going to help, psychotherapy are going to help him in recovering himself and coming back to his regular life and normal life. That is why I decided to use these three therapies, psychotherapies, to help my patients. So now let us meet our patient. Welcome back to the clinic. Um, I will first of all, I will want to seek your permission to use this section interview for educational purposes in UMass Global. Is that okay with you?
Permission granted. It's okay with me.
Thank you. Yes, so tell me, how are you feeling today?
I've been feeling so bad. It's not been easy. Feeling so depressed. Nothing moves on well with me. Different thoughts. In fact, I'm not okay.
Oh, okay. And I know the last time we met, you mentioned that you had mood changes, feeling helplessness, sadness, and irritable. Now, has anything changed since the last time since the last time we met?
It's changing for the worse. Going further, the mood changes is going further and further down. And most times I feel so bad, I don't get myself as usual.
What do you mean is changing for the worse? Like what is actually going on now? At least since the last time we met. How irritable are you? How sad are you? How is your behavior? How can you what can you tell me about your behavior?
I feel so sad. I feel so bad. I feel so abandoned. It's like I'm in a world of my own. And it's like I feel the world of mine ends today.
Oh, okay. Tell me again, what is actually going on in your mind? Do you have any thought of hurting yourself or hurting other people? Any thought of committing suicide or homicide going on in your mind?
I do not have such thoughts at the moment,
Okay.
notwithstanding the condition I find myself. I do not think of hurting anybody or hurting myself.
Okay. I'm glad to hear that because we always want to know so that we can help you in that regard. Okay. So, how do you spend your time?
I spend most of my time, when I'm not at work, I spend most of my time on my own, sort of recline to myself, because I hardly associate with my friends. I stay alone most of the time when I'm not at work.
Oh. So, don't you think I'm just gonna ask, when you go to work, don't you think that your friend, you can find company in your friends, talk over things with your friends, not really telling them your problem, but being friendly with them, going to work, that might distract you a little bit from thinking so much about your wife.
That helps to a certain extent when I'm with my friends, but as soon as I'm off with them, I go back to my mood. And such moods, I don't really find it funny because it is not easy at all. Each time I have the thoughts of how I was with my wife when she was around.
So you were very close to your wife.
We were very, very close. She was everything to me. We were very close. Her departure was a good shock and least expected.
Was she sick or she just died?
She was just brief illness.
Brief illness. I'm so sorry to hear that.
Thank you.
Okay, that we will end our section today. You will have another section next week, so I'll be looking forward to seeing you next week. So you have a great day.
Thank you very much. You too.
Hello and welcome to today's section. Today is your second section. Um, so tell me, how are you doing today?
I'm good today. Thank you very much.
Is there anything that has happened since the last time we met?
Yeah, quite a lot have happened. Because according to your advice, I have tried to relate more with my friends and my colleagues, and I feel that I am getting the much desired comfort and help from my association with friends and colleagues at work. And to crown it all, my children are there. They've also been there, always come around to be with me, and their presence also helps in giving me some sort of comfort.
I'm glad to hear that. I'm glad to hear that at least your association with your friends and your family is helping out. Um, that is so good to hear. Okay. So tell me about your children. How many children do you have?
I have 5 children, and I have 4 grandchildren, and they have always been supportive. Their presence always make me happy. And of recent, having noticed the mood changes I had in the past, they always try to be around me and to keep me company and then to keep me comfort. And that
Awesome.
has really added a great lot of changes to my life.
That is so good to hear because since you have such family support, that is going to help you a whole lot. Now they understand what you're going through because they are the ones that urged you to come and see a therapist. So they already know what you're going through, and I think they are going to be there for you and support you in all that you're going through now. Okay.
I believe so.
Okay. Good. And you know that you staying alone and not mingling with people will make you feel more lonely, more sad, and you have your wife in mind all the time. I'm not suggesting you should forget your wife, but you need a little distraction for now because it's really affecting you and affecting your mood. Okay.
That is true. Thank you.
Okay. When you are irritable, when you say you are irritable, what goes on with you? What do you do? Do you talk back at people, um, abuse people, or get violent? Or describe your irritability to me.
Each time I find myself irritable or in such condition, what I do is to recline to myself. I just recline to myself and keep away from people so that I don't do some damages, collateral damages that will not figure well for me in future.
That's good. Glad to hear that. Okay, thank you. That will end our session today, and I hope you have a nice day, and I will see you next week for your thoughts section.
Thank you very much. I appreciate it.
Hello, and thank you for coming to this section. This is your thoughts section so far, and so tell me, how are you feeling today?
I look much better than before. Thank you.
Were you looking forward to coming today?
Yes, of course. I look forward. Each time I have this session with you, it has been a great day after my interaction with the session.
I'm glad to hear that. So tell me more about this therapy. How has it helped you?
The therapy really has been of great help to me because before now, I've been finding things so difficult, my mood changes and whatever. But since I started attending this therapy and putting some of the suggestions and advice you gave me into practice, it's been so wonderful. And I think I'm gradually getting out of my former situation and things are getting better.
Okay. Now tell me, do you have any thoughts of remarrying?
This one, in this case now, my culture comes in as an African American. My culture dictates that if one loses one's spouse, that one is bound to at least observe 24 months of mourning. That is 2 years of mourning before one can think of getting remarried. So bearing that in mind, that is out of my mind for now because it goes against my culture.
Oh, that's a good culture. So you have to stay 2 years before you marry.
Yes, that's what it is.
Oh, okay. Anyway, I'm glad your family, your children are there for you, your grandchildren. So, what other thing makes you happy? Do you belong to, like, I will encourage you to belong to church groups? Do you belong to any group in the church?
Yes, we belong to groups in the church. Even when my wife was here, she belonged to some groups, some women group. I belong to the men group. And those women group and even the men group have been of immense help to me. From time to time, they try to come around me to find out how I'm feeling. Most of them, from time to time, they give me phone calls. And then we discuss to find out how I'm faring. And from time to time, they pay visits. And then we go out for different ceremonies. And while we are there, I try to keep aback the mood I have been having in the past. And then my children also have been so wonderful. My grandchildren, they have increased the number of times they come and stay along with me. And each time I'm around with them, I try to forget the events of the past and then move ahead.
Yeah. I'm glad you have such support, such family support, and even your friends. I'm so glad to hear that you are getting enough support, and I want to encourage you to keep with those groups, because that will help you to, that will help you to overcome this situation that you have. Thank you for this section, and pray that you continue with this therapy, okay, and that is going to help you better. Thank you so much for coming.
Thank you. I appreciate it.
You have a blessed day.
And you too. Thanks.
So, in conclusion, psychotherapy increases the ego and decreases the pressure of impulses, giving the patient the freedom to run their full life, to communicate better with the external world. In this case, if the patient continues to attend these therapy sections and understands the good of these 3 therapy sections, given the willingness to change his behavior, he will benefit from psychotherapy. And from what he has already said, he has started benefiting. He's coming out of his mood and he's feeling a lot better. And I want to encourage him to continue to attend the remaining sections that are, so that he will snap out of this depression. It's not easy, but it's doable. Thank you. Thank you for listening. Thank you. Bye.